Se inicia la sesión.
Bueno, muy buenos días. Mi nombre es Ludovic
Good
Reveis.
morning. My name is
Soy líder de la
Ludovic
unidad de
Reveis.
conocimiento
I
para el
am
impacto del
the head of the
Departamento de
unit
Influencia e
of
Inteligencia de la
knowledge
OMS en la oficina de
for
Washington,
impact
D.C.
at the office in
Esta
Washington,
sesión
D.C.
está
This
en
session
inglés y en español. Si
will
ustedes
be
pueden ver las
interpreted. You will
interpretaciones,
hear it in
escogen
English
el
or
idioma en
Spanish.
el cual
If you
ustedes
wish to hear
quieren
the interpretation,
escuchar y
click on the
participar.
globe at the bottom of the screen and
Este
select the
año
language
la
in which
OMS
you wish to
organizó
listen.
en
This
Brasil una
year,
reunión sobre
PAHO
genética
organized in
humana en la que se
Brazil
discutieron
a meeting
las
on
diferentes acciones
human genomics where we
concretas
discussed
para promover
many
la
concrete
investigación en
actions
genética y
to
su
promote
implementación en las
genomic
políticas
research and
y la
influence
práctica.
on policies and
Iniciamos
practices.
hoy una
We
serie
are
de
beginning
seminarios
a
virtuales sobre
series of
genética humana
seminars
que
today
hacen
on
parte
human
de estas
genomics,
acciones.
which are
En
part
esta primera
of
sesión se
those
centrará en
actions taken.
presentar el
The first
informe
session
de
will
la
focus
reunión
on
y
presenting the
explicaremos
report of
aspectos
that
para
meeting
potenciar el
and
impacto de la
some
investigación
issues to
efectiva
enhance
sobre
the impact
enfermedades
of
raras y
research,
trastornos
effective research on
congénitos.
rare diseases and congenital
Esta
disorders.
sesión tiene varias componentes. La primera
Today's
es la
session has
presentación del
several
informe de
parts
las
to it. The
reuniones
first is the
organizadas de la
presentation
OMS
of the
y
meeting
luego
that
algunas de las
I
acciones
mentioned earlier
concretas.
and some of the concrete
Una de
actions
ellas
that
es
have been
establecer
suggested.
un
One
hub
is to
en el cual estamos trabajando
establish
desde
a
OPS de
hub
genómica
that
que
we're
incluya
working
genómica
on
de
at PAHO
patógenos y
on
genómica humana.
genomics, which would
Y eso es algo que
include
esperamos que sea
pathogenic
muy útil
genomics
para
and
la
human
compañía.
genomics. And we're hoping
Me
to
acompaña
organize
el doctor
this
Pablo Durán,
seminar
que
on
es
this by
asesor
next
regional
week.
en salud
Dr. Pablo Duran, the
neonatal
regional
del Centro
advisor on
Latinoamericano de
neonatal health at
Perinatología
the
y Salud de la Mujer y
Perinatology Latin American
Reproducción
Center and
de OPS.
Reproductive Health of Women
Y
at PAHO,
asimismo estará moderando
is
la
with us.
sesión la
Also,
doctora
we will
Isha
have
López
Dr.
Sendes, que es
Ishia
médica
Lopez
científica
Sendes,
y profesora de
physician,
genética médica y
scientist,
medicina
and
genómica
a
en la
professor of
Universidad de
medicine
Campiñas
and
en
human
Brasil.
genomics in
Además,
Campinas,
presidenta y
Brazil
miembro del
University,
Grupo Asesor
and
Técnico de
a
Genómica de la OMS.
and a
Y la
technical
doctora
advisor
Sherry
on
Taylor, que
genomics
es
at
genetista molecular
WHO, and
que
Dr.
es
Sherry
profesora
Taylor,
asistente
who
del
is a
Departamento de Genética
geneticist
Médica
and molecular
y también
scientist,
tiene un
and
nombramiento conjunto en medicina del Laboratorio de
has
Patología de la Universidad de Alberta, Canadá,
works
y
at the
también es
Office
miembro
of
del Grupo
Alberta,
para el Estudio
Canada,
Clínico de
University of
Genómica.
Alberta, Canada, on genomics
Pablo,
and
adelante, por
medicine.
favor.
Pablo, go ahead.
Muchas gracias, Ludovic.
Thank you very
buenos
much,
días.
Ludovic.
Es un
Good
gusto
morning.
participar
It
junto
is a
con el doctor
pleasure
Ludovic Reveis
to
y el resto
participate in
de
this
los
webinar with
moderadores,
Dr. Reveis and the
moderadores y
other
presentadores en este
moderators and
seminario
presenters
Potenciar el
on
impacto de
this
investigación
seminar on
efectiva sobre
enhancing the
enfermedades
impact of
raras y
effective
trastornos
research on rare
genéticos.
diseases and
Este
congenital
espacio, este
disorders.
seminario,
This seminar,
como ha sido mencionado, en
as has
coordinación
been
entre
mentioned,
la Unidad de Ciencia y
is
Conocimiento para
organized
el
in coordination
Impacto
with the University
y
of
el
Science and
CLAP,
Knowledge for
estuvo
Impact and
pensado desde un
CLAP.
comienzo como un
And
espacio
originally,
para
we had thought of
reflexionar
this as
sobre la
a space
importancia de la
for
investigación en salud
reflecting on the
a partir de
importance
la
of research
reunión
in
realizada en
health
Brasil,
based
en
on the
relación,
meeting that took place
además,
in
en este
Brazil.
caso
And
particularmente,
in
con
this
problemas
specific case,
relevantes
we wish to
como
focus
son los
on
que
the
se han
relevant
mencionado,
issues such as
las
those
enfermedades
mentioned earlier,
raras
that
y
is,
los
rare
trastornos
diseases
congénitos.
and congenital
Somos
disorders.
conscientes totalmente de la
We
importancia
are
de las
fully aware
contribuciones
of the importance and
presentes y
contributions
potenciales de los
that have
conocimientos y
been made and
prácticas
will be
emergentes
made
en genética y
on
genómica
genetics and
brindan en
genomics
muchos
and
ámbitos que
what these
hacen a la
practices can
vida
provide
en el planeta y en
to
el particular en
many
salud
areas
mental.
of life on the
Pero
planet,
también somos
particularly on the
conscientes
impact it has on
del
the
impacto
health of individuals.
fundamental,
But we're also very
en el caso
aware of
particular de
the
la prevención,
fundamental
el
impact it
diagnóstico y el
has on prevention,
tratamiento de
diagnosis, and
enfermedades
treatment
como las
of
vinculadas a trastornos
diseases such
genéticos,
as those linked
cromosómicos,
to genetic
alteraciones estructurales y
disorders,
funcionales
chromosomic
o
or
aquellas
structural
enfermedades agrupadas como
alterations,
enfermedades
or those
autoinmunes.
diseases that
Los
are
defectos congénitos
generally
sabemos que
referred to as
representan
rare
la
diseases.
segunda
We
causa de
know
muerte en menores de
that
5 años,
congenital disorders
que
are the
junto con las
second
enfermedades poco
largest
frecuentes y
reason for
otras
death on
condiciones
children under
perinatales
5,
se
and
encuentran entre los
the
grupos de
rare
menor medida
diseases and other perinatal
comprometen
disorders contribute highly to the disease burden and disability burden of an individual. And we are also very aware that this will affect the life, the health, not just during the perinatal period, but throughout the life course. And we also realize this has an impact on the families, the communities, and society, and that this will necessarily involve many stakeholders and institutions. It involves issues that we need to discuss and consider so that we can achieve results and impact based on evidence and our knowledge. Today, in genetics and genomics, we're able to detect changes from the very first stages of life, and there is an unprecedented potential for detection, treatment, and improvement of the quality of life. That's why the perinatal and antenatal stage of life are crucial, and the knowledge that genetics, genomics provide us and the application of this are essential for improving the quality of life of the individual, families, and communities. During this time when scientific and technological changes are occurring at great speed and of great impact, it is very important to not only consider the results, but the challenges this presents. The application of what has been learned and the new applications requires the development of ethics and respect, particularly since we know that the health rights should guarantee that individuals have equitable access to all this progress, and that this is fundamental. That is why in today's society, we have to respond to pushing and developing scientific and genealogical progress, but from the perspective of equity and the rights of the individual. Today, more than ever, research on rare diseases and congenital disorders has the potential to change lives, but we also think it's very important to be aware of the responsibility we have to ensure that the benefits of this progress reaches everyone in a fair and accessible way. That's why we once again thank you for your presence at this seminar, and we hope that the exchange we have is a rich one, and we will be able to come up with inclusive solutions for the health of individuals. Thank you. Thank you, Pablo. Let us now move on to Dr. Sherry and Dr. Itzia. Go ahead.
Hello. Welcome to everyone. Just before we get started, just letting everyone know that we are going to take questions at the end of all the speakers' sessions, and that we will be using questions that are submitted to the Q&A box at the bottom of the screen. So if you will make sure your questions get in there, we'll address them at the end. Okay, so it's my pleasure to introduce Dr. Gabriela Repetto. She is a clinical geneticist and genomic researcher from Chile, and she is also a member of the WHO Technical Advisory Committee on Genomics. Gabriela?
Thank you, Sherry. And thanks, y muchas gracias a los organizadores por
Thank you
invitarme
very much
a
to
esta sesión y
the organizers for having
también
invited me to
generar
this
esta
session,
instancia
and my congratulations for creating this opportunity for discussion, and I hope we have many more of these kinds of seminars. I've been asked to summarize some of the points made at the meeting that Dr. Reves referred to at the beginning, human genomics for health, increasing or enhancing the impact of effective research. I will talk about what was discussed at the meeting and present some of the most significant decisions. The document itself can be found through this QR code on the right. It's only in English right now, but the translations will soon be available. It also, in the Q&A chat, I have put the link. This is the first meeting on human genomics and health in the region, and it took place in May of this year. It was organized by the Pan American Health Organization with the support of the World Health Organization and the Ministry of Health in Brazil, specifically the Department of Science and Technology. We were warmly received at the PAHO headquarters in Brasilia, and the format included 25 presentations and 4 interactive group sessions. There were more than 100 participants at the meeting, more than 80 guests from countries and the regions of the Americas that you can see represented here. And not only did we have a very varied geographic presentation, but we also had representatives from many different levels of expertise, such as public policy, bioethics, clinical services, the economics of health, research, and other topics as well. The objective of the meeting was, first of all, to disseminate what I believe is one of the founding documents for this genomic strategy. It was the scientific report of the World Health Organization entitled Accelerating Access to Genomics for Global Health, Promotion, Implementation, Collaboration, Ethical, Social, and Legal Aspects. Following that, through the interactive groups, we shared experiences and good practices, both in the area of implementing these at the level of health, but also at the level of research and populational health policies. We also were able to identify challenges and propose feasible strategies that could be implemented in the region and for research purposes. I think the best thing, it was allowed us to network and establish regional collaboration. At the top, you have the QR code to the scientific report of the World Health Organization, which is different from the meeting I'm discussing. The first day focused on clinical implementation. We first had the opportunity to hear about the report that I just mentioned, and then the progress made by the National Genomics and Health and Precision Medicine program in Brazil. We also had specific discussions on clinical applications such as cancer and infrequent diseases. Also, we had the evaluation of health technology, and we talked about strategies for financing high-cost technologies, and we concluded looking towards the future, looking at gene therapy and its application. In the second day of the meeting, we focused more on research. Here, we heard about national and regional initiatives, about the regional collaboration networks, which we're going to hear about a bit later in this presentation, research in the area of pharmacogenomics, and other things that are so important for research. That is the availability of resources, data shared, and also ethical issues that are extremely important when we share data. We identified 4 key priorities for this region. It covers both the clinical as well as the research side. One is the need to strengthen the human resources in the clinical application of research, bioinformatics, bioethics, etc. Secondly, we discussed how can we establish solid financing so it doesn't depend on political whims or other fluctuations. Third, relevant aspects of public policy. And finally, we talked about the need and Dr. Reyes referred to this, about the need of setting up regional hubs so that we can take the best advantage of existing infrastructure. Because of the shortage of time, I won't go into the details of all the proposals made. I just selected some here. I think in the area of human resources, that was the issue most commonly discussed. We felt there was a big gap here. We talked about the existing skills and the need to use hybrid training courses and to develop standards for genetic counseling and the training for genetic counseling. In terms of infrastructure, we felt we should have develop a survey of the equipment and resources that exist in the region, particularly in countries that have smaller populations for whom it's more difficult to have a sustainable volume of patients to make this kind of genomics technology is sustainable. So how could we share resources amongst all of us? Financing is another big topic, particularly in Latin America and the Caribbean. We have additional costs, or often the prices are much higher than in countries in the global north. So we talked about the possibility of developing mechanisms for regional negotiation. And we also asked PAHO and WHO to support the importance of genomics in policymaking. Another area was economic analysis and value analysis to be able to demonstrate the value of genomics in health and to communicate to all involved that they should encourage investment and development of this field. Another aspect was public-private cooperation, and we also talked about the importance of getting society to understand and accept the use of genomics. And finally, we talked about ethical and regulatory aspects, which are a fundamental basis for this. We believe that we should encourage an intersectoral dialogue on this and the training of individuals for this purpose. So we still have a lot to do in the region, but I do think that the community is committed, it's enthusiastic, and we feel that collaboration and dialogue will be a key part of this. We've talked about, in addition to developing technological hubs, that we should develop or set up a regional committee that could address the key issues of regulation, education, research, and clinical practices, so that we can coordinate regional, national, and local actions so as to expand genomics and improve the health outcomes in the Americas. Thank you very much.
Thank you, Gabriela, for the nice talk. And now move to our second speaker, who is Dr. Nathan Monsoris de Sá. He is the General Coordinator for Rare Diseases at the Brazilian Ministry of Health, and he will be speaking about genome sequencing for diagnosing rare diseases in the context of the Brazilian public health system. Nathan, you have the microphone.
Thank you, Iskia. Thank you, everybody. I will share my presentation. So, yo voy a hablar en español. ¿Qué Iskia?
I will be speaking Spanish. I'm Nathan Osores. I am the coordinator for rare diseases at the Ministry of Health in Brazil. I'm also a professor at the University of Brasilia, where I was head of the public health department, and I coordinate the Observatory for Rare Diseases. I'd like to thank PAHO for this invitation to be with you today to talk about the Brazilian initiatives in the field of genomic diagnosis of rare diseases. General coordination for rare diseases is part of the structure of the specialized care department at the Ministry of Health. This means that part of some of our efforts are focused on organizing care lands, the protocol of care, and to deliver actions for laboratory and clinical diagnosis, and guaranteeing the quality of life and access of people with these rare diseases to the specialized services. Our actions aim to implement a national policy for integral care of people with rare diseases. This policy, created in 2014 in Brazil, organized a network of services and a number of guidelines to guarantee health care and the care delivered to people with rare diseases throughout the country. The coordination of these rare diseases was created in 2023 and has focused on ensuring the functioning of the network in Brazil for specialized services and rare diseases. Our work was guided by policies directed by incidents. This means that our actions will always be based on the best available information in biomedical literature. We try to design our actions and try to promote the creation of new evidence through our network so that the actions become sustainable, focused on real-world elements. When we took over coordination, one of the major requests for reference service was the need to have a situational diagnosis. In the first year of existence of the coordination, we carried out diagnostic work seeking to verify with all of the different departments what the needs were for care, the problems in establishing them and the flow, which was the populational profile that they were caring for. We wanted to generate data that had not been completely available to the Ministry of Health. In addition to this dialogue with the reference services, we also look through biomedical literature to support decision-making processes for a future network of reference laboratories in order to be able to provide molecular and genomic diagnosis. There are a number of international publications today that talk about the exome and genome sequence, and these have become more accessible both from the point of view of technological execution as well as team availability. There has also been a progressive cost reduction. This means that access to this type of technology has now become a partial reality, essentially in healthcare, linked to the structure of university research. In Brazil, most of teams focusing on genomic diagnosis are in that kind of situation. There are research groups throughout the country, and in recent years, they received support through the Brazilian government and were able to buy sequencer and other equipment that they needed. But the major challenge is to transform this research capacity into the capacity for in vitro diagnosis. And that way, the teams will be able to care for the volume and with the necessary speed for diagnostic demand. The rhythm at a research laboratory is quite different to that of a clinical analysis laboratory. The type of list that this kind of diagnostic laboratory needs, such as to observe specific health standards, is also very different. In addition, what I'd like to point out is that there are a number of recommendations that can be seen in biomedical literature referring to procedures in order to conduct a genomic evaluation in a clinical scenario. Given the short time we have available at this seminar, I'm not going to go into detail of these points, but there are documents available generated by PAHO that do provide a lot of this information. information. One of the missions of the Office of Coordination for Rare Diseases is to make the network of specialized services in Brazil, make it operational. In Brazil today, there are 36 clinical services, but there are some areas that need to be solved because many of the reference centers are concentrated along the Atlantic coastline, essentially in the capitals of Brazilian provinces. This poses a challenge in order to guarantee to the populations in the north of Brazil and the provinces of the interior appropriate access to clinical services that are able to promote the diagnosis based on genetic studies and clinical follow-up. We are working to encourage managers to set up services in the northern and central regions of Brazil. In recent years, we've also gained the capacity of monitoring the population in the field of rare diseases. We began to have some population indicators allowing us to confirm literature. In fact, we are working with diseases affecting people in childhood period. So some of our efforts need to be focused on social and clinical opportunities or locations where we find these population, such as in pediatrics, maternal care, and those that provide the early childhood life cycles. We can also think about schools because some of these children will face challenges when it comes to their intellectual and motor development. I must also talk about the best data about metabolism and about immunity, because these will be important factors in the early years for these children, having a strong impact on their nutrition, access to vaccines, etc. This means that we need to have rapid and timely diagnosis in order to guarantee or at least provide an opportunity to these children to have a good quality of life. In the last decade, Brazil has built capacity so that genetic and genomic studies can be made available. I can cite the initiative of the National Program for Genomic and Precision Health. This has generated capacity in the single health system of Brazil, generating evidence and new treatments for diseases with a genetic basis. Unfortunately, I can't go into detail today about all the actions because we have a limited amount of time at this seminar. Nonetheless, I would like to point out that the Brazilian government has thought about the dimension of equity in selecting new initiatives. Decisions to expand or scale up the laboratory network for these rare diseases in Brazil has been evidence-based thanks to these research activities financed by the Brazilian government. One example is the RARAS study in Brazil that looked at the availability of genetic tests for the public health services, as you can see on the maps that I'm about to present now. This information made it possible for the Brazilian government to generate sufficient evidence for decision making. This is one of the research articles published by a Brazilian group, and the coordination of rare diseases also performed a situational diagnosis to confirm the fact. We have many major points to focus on. One is to update the technological infrastructure. The second problem we face is to have computer and geneticists and to ensure greater availability in Brazil. About 60% of the clinical cases supported by the Brazilian Genetics Services have a molecular and genetic or biochemical study, but most services do not yet have the technological infrastructure needed to do the sequencing or new generation sequencing, NGS, next generation sequencing. To address this first problem, services have been invited to move into a transition for towards the next generation sequencing in their research in order to use their capacity for in vitro diagnostic. On the basis of this situational analysis, we have generated some guidelines through the government of Brazil to tackle some of the problems that have been seen. This is a scenario that allows us to produce WGS, whole genome sequencing, for research and to assess or evaluate new technologies. These sequencing centers have worked to respond to the Ministry of Health's requests, but we need these centers to change their capacity in order to do in vitro diagnostics. We, at our centers, have developed flows to carry out these genomic studies. Many of these have already been validated through projects having to do with Genomas Brazil, Brazilian genomes. Brazil also has the National Institute for Science and Technology for Rare Diseases, and it brings together the expertise of different groups working in the field of rare diseases. These actions have made it possible to have an economic assessment as to the cost for the SUS, the SUS, which is our department. This type of examination needs to be cost effective in order to be sustainable. It's also important to point out that these not being low cost tests, the processes need to be very, very specific. Let us not forget that these initiatives need to be supported by good team training in order to provide genetic counseling. We have worked to standardize information. It is extremely important to recall that this needs to be supported by robust clinical information so that the laboratory study is useful to the physician or the team that provided the genetic counseling. Some of this information has been worked on in Brazil. Right now, we are working to define the flows. Fortunately, and as I mentioned earlier, in recent years, research projects are helping us already today through the knowledge generated. But the official flows will be easier because we have already started to standardize this. But nonetheless, we face challenges. We need reference genomes for Brazilian population. First, we also need to talk about genetic counseling. We need to have the right level of literacy in genomics for medical professionals. And as I've already mentioned, there is a scarcity of geneticists in Brazil, which means that we need to disseminate or reach out to other fields of specialization so that they gain the skills to work with genomic information. Another thing I need to mention is the many questions in data sets and ethical problems and bioethics. These are areas that need to be refined in order to be able to produce reports. Let me also mention that the pharmaceutical industry today is managing substantial resources for rare diseases and to develop advanced therapy with biologics. It's important, but the cost of these therapies have been prohibitive. Therefore, we needed to evaluate in this equation the cost equity equation. We can't always support these expensive therapies, so it's important to clearly understand that an increase to genomic treatment will also increase demand for specific cares of rare diseases. It is not sufficient to simply provide testing. We also need to have care, provide care for this type of specific population. Lastly, on this slide, we have summarized the major challenges that we encountered to implement a public NGS system in the Brazilian public system. The challenges range from information infrastructure to counseling levels. There are many challenges, no doubt about it, but the Ministry of Health of Brazil has made efforts to ensure that patients have access to basic medical care, but also precision care. I thank you all for your attention. And on this slide, I am showing the motto of our organization: to know, to receive, and care for people with rare diseases. Here you can see our email. I thank you for your attention.
Thank you very much. Okay, I will introduce the next speaker. We have Dr. Ignacio Zarante. He is from Colombia. He is a professor in the Human Genetics Institute at the Pontificia Universidad Javeriana in Bogota, Colombia. And he's also a member of the Latin American Collaborative Study for Congenital Malformations. He'll be talking about that collaborative study today.
Buenos días para todos. Es un placer estar aquí con ustedes. Hoy quisiera presentarles una
Good
iniciativa
morning.
que lleva más de
I want to
50
present
años desarrollándose,
an initiative that's
que es
been
un
in the works for
ejemplo
over
para
50
potenciar
years. It's an
la
example
investigación en defectos
to give greater
congénitos y
strength
enfermedades raras.
to the research of congenital
Yo
diseases
soy un
and rare
miembro
diseases.
de
I am
este
member
grupo del estudio
of this
colaborativo
group of the
de manejo de
collaborative Latin
malformaciones
American
congénitas,
collaborative study of
pero
congenital
nuestro,
malformations.
este fue
And I wanted
creado
to
por el
show
doctor
you
Eduardo
this
Castilla
image of
en
Eduardo Castilla, who
1968
generated it
y
and
actualmente
who gave
este es
rise
el
to this
grupo
study.
coordinador que se
And this is
encuentra
the
entre
coordination group
Argentina y Brasil.
that brings together people from
El
Argentina and
ECLAM es muy
Brazil.
importante tener claro que es una
It's
red
important to
de
keep in mind
investigación
that
clínica y epidemiológica
ECLAMP is a
que
network of
busca
clinical and
entender cuáles son los
epidemiological
factores de riesgo
network
que
that
son
seeks to
subyacentes a los defectos
look
congénitos
for the risk
en todos los
factors in the
países de
etiology of
Latinoamérica.
congenital anomalies in
El
Latin
tema, y
America.
siempre nos lo
The
decía el doctor Castilla,
issue, and Dr.
la
Castilla
letra más
always said
importante
this,
del
the
ECLAM es la
most
C, que es
important letter in
colaborativo.
ECLAM
Este
is
es un
C, is
trabajo que es un
collaborative.
acuerdo entre
In other words,
profesionales
it's an agreement
dedicados a estudiar anomalias
amongst
congénitas,
professionals
los cuales
devoted to
estamos
studying
en
congenital
todos los países de
anomalies
Latinoamérica.
in all of
Hoy en
Latin
día esto ha
America.
venido cambiando y ya hemos
Today,
empezado
this has been
a
changing.
incluir
We've
unas
started
instituciones
including
principalmente
other
hospitalarias
institutions,
que entran de
mainly
forma
hospitals,
institucional.
that have joined us as institutions.
Para dar un pequeño marco
And
conceptual,
to
recuerden
establish
que
the
tenemos
conceptual
una
framework,
primera
keep in
iniciativa que
mind
es
that we
estos son
had
los defectos
the first
congénitos o
initiative,
también
which
llamados
was
anomalías. Pueden
anomalies
ser
or congenital defects.
estructurales o
And
pueden ser
these can be either
funcionales. Y
structural or functional.
principalmente el ECLAPS
And
ha venido
what ECLEC
trabajando
has
desde el
done
punto de
mainly
vista de las
is
alteraciones
work from the
estructurales
perspective of
llamadas
structural
principalmente
alterations.
malformaciones congénitas.
usually referred to as congenital malformations. We shouldn't forget that congenital defects may also be functional, where we see children who, when you do a physical, a clinical exam, they look perfectly healthy, but they may have errors in metabolism or sense alterations such as blindness or deafness or motor alterations. And these are often considered rare diseases. And in the last 10 years, we've been working in ECLAMP and other groups as well, where we believe that the surveillance we've developed and the public health strategies that we work with on congenital defects should also be applied to rare diseases. Many countries in Latin America, like Uruguay, have started to do surveillance with one single system of congenital diseases and congenital anomalies and rare diseases with countries such as the United Kingdom. Now that's crucial because all the research we may be doing in genomics, as was shown in the last presentation, or any research we may do on genetic causes or environmental causes should keep in mind that there's a very close link between congenital disorders and rare diseases. They basically share the cause and the risk factors, and many of them have similar treatment. When we talk about birth defects, these have a huge impact in all the countries where we work, where mortality for infectious diseases has now gone down, but we're beginning to see a preponderance of birth defects. It affects between 5 and 10% of all births, and it has an impact on the quality of life of the child, and of course, an impact in the development of countries as well. The network consists of many hospitals that includes hospitals in all countries in Latin America. Right now, we have more than 3 million sites reporting. Originally, it was for the purpose of obtaining information and coordination from each hospital. But when we started doing research projects, collaborative research projects, we see how the networks form in a different way, because we develop projects on specific topics where we've included some hospitals that have a geographic or contextual relationship to the disease. This here's an example of one of those meetings we had, scientific meetings. It began back in 1979, and now they've been meeting for 56 years on a consecutive basis. We met in Buenos Aires last week. What do we do in ECLAMP? Mainly, we investigate risk factors because we use the system of cases and control studies. Then we have surveillance on the number of births in each region. We do epidemiological surveillance. And one key aspect is the geographic clusters, where we see an occurrence of a congenital defect arise. And that idea behind it is to find either the environmental causes or including what we call prematurity, because prematurity often has the same risk factors. When you think about the impact that this network has in the area of research, if you look up in PubMed, you'll find that yesterday there were 373 publications from ECLAMP. Here's an example of the geographic distribution. See how you can compare frequencies in different hospitals. You'll find that there's some regions where there's a greater frequency of polyactylia poxtaxial, or in Peru, leporinal lips or split lips, and in Sao Paulo, a different disease. So when we talk about what ECLAMP has done, we've looked at the impact that neural defects have. Here you see an analysis of how you change the neural tube defects when we change the increased folic acid, the sex that was most affected changed. We not only work through network, but we've seen new networks arise now, one supported by WHO, the International Clearinghouse for Birth Defects. Again, we also do research with them. Again, ECLAMP is a protagonist because we provide the information where several countries in Latin America have joined these other global programs to generate even more data, a greater quantity of data, to see if we can find a response to the etiology of birth defects. And again, if you look at the example of this meeting of birth defect records, we created another network called RELAMP, where we have a registry of the green network countries and the gray countries to generate research projects to provide a specific response to cardiopathy and tropia, where we were able to have a greater impact by bringing the data from all of these centers to one place. We've also developed tools. The idea is to train the entire region. Here you can see a page where anybody can go to this page and see information on birth defects. Here you have a video of how you examine a child to find a congenital disorder, and the diagnosis so that you can compare with your patients. Contributions to public policy. This is one meeting we had in Bogota, a global meeting on congenital defects, where with the help of WHO, we were able to generate consensus on how birth defects should be handled from the perspective of surveillance, prevention, and care. And this created most of the guidelines that most countries in the region now follow. Thank you very much. That's what I wanted to share with you from the perspective of CLAMP. Here we have all in this little globe, we have everything covered except for the little white spot, which are the birth defects and congenital diseases. Thank you very much.
Thank you very much, Ignacio, for this wonderful talk. I'm a big fan of this program, and we'll be able to discuss a little bit at the end. So now we move to our last speaker of the session, who is Dr. José Elias Garcia Ortiz from Mexico. And Dr. Garcia Ortiz is the president of the Latin American Network of Human Genetics, RELAC. José Elias, the microphone is yours.
Gracias, doctora Isia. Muchas gracias a la Organización Panamericana de la Salud.
Thank you very much. Thank you very much to the Pan American Health Organization and organizers for giving us this opportunity to talk to you about our initiative, Latinomics, which is an initiative of the Latin American Network of Human Genetics, which I will now present to you and describe what we are doing. RELAC is a network of associations or societies that deal with human genetics or medical genetics in general. We have coverage in almost the entire region. We communicate with almost all the local societies, and that's how we are able to develop projects and initiatives that could have a regional impact. Today, I'm going to speak specifically about a working group that we have developed that focuses on genomic sciences called Latinomics. It's a regional initiative created to transform the health and well-being of Latin American populations through the application of research in genomic sciences. Our main purpose is to promote equity, collaboration, and access to advanced technologies, thereby leveraging the genetic and cultural diversity of our populations, because we believe that this is one of our best values. In order to develop solutions for public health, that is personalized and sustainable. So this is a collaborative network that brings together academic efforts, academic institutions, but not that, also governments, international organizations, and particularly the private sector, in order to establish collaboration for the purpose improving our health system and improving our local capacities. Because as you know, not all countries in the region have these same conditions or opportunities or capacities. And so what we want to do is standardize and make it more homogeneous so that those countries with less opportunities, less possibilities, also have access to human genomics. This is not a new initiative, of course. There are many worldwide, as many of you have heard of, the UK Biobank, the H3 Africa, the Genomas Raros, the one in Taiwan and one Korea. And each one of these initiatives has different missions to accelerate public health or research, or to establish a collaboration between local researchers, or to establish specific diagnosis for rare diseases, cancers, or genetic disorders in the population. This initiative started about a year ago during a side event of the American Genomics Convention in Washington, where several colleagues proposed the establishment of this kind of an initiative. And so after that meeting in December, we met with a group of other researchers to try to come up with this idea, to develop what should be our expectations, where our capacities, abilities, and establish a work plan. So we started the work plan at the beginning of the year by establishing work strategies, collaboration proposals with groups, external groups that could help us develop ourselves. And then over the year, we've already had 8 virtual meetings and 10 meetings and 1 meeting in person in Medellin, Colombia, where the network was formally established through the Medellin Declaration of 2024. We've also been working on a strategic collaboration paper to come up with a white paper where we will lay out the roadmap to attain our objectives. We have officially presented this initiative to Latin America at the Latin American Conference that took place in ethics, that took place in Guadalajara in October, and to the international community at a side event in Denver in the Inter-American Convention on Genomics. And at the moment, we are trying to establish relationship with scientific bodies, research groups, and international organizations that will allow us to set up these collaboration points. We don't want this to be a new initiative. What we want to do is coordinate our efforts so that the working groups, of which there are many in Latin America, can have a space where they can share information in an ethical, professional way, respecting our values, so that our mission is to promote research, the development and transnational equitable innovation in genomics and other omics sciences in Latin America, in order to improve the health of our population and thereby contribute to universal knowledge. So what are our values? Collaboration, diversity, equity, ethics, innovation, integrity, and above all, sustainability and transparency in the activities that take place. Some have talked about situations where about helicopter research, which is a problem that often affects our populations. And these are issues that we want to combat in a transparent manner. And our vision is to have a Latin America that becomes a leader in innovation in genomics and other omics, integrating our region's genetic diversity to advance science, health, and particularly the equity amongst our populations. We want to see communities that are empowered by genomic knowledge, where collaborative and ethical research will drive personalized and accessible health. And in this way, Latinmex's vision is to become a global reference point by bringing together researchers, health professionals, patients, and policymakers in a common effort for a healthier, informed, and mainly an equitable society. As I mentioned, this Medellin Declaration has been published on our website. In this QR code, you can access it directly, or you can find it on the RELAC page, which is relac.org, where you will find the complete declaration. You'll see the link here. And this is the working group, and this is the strategic guidance document. We're still fine-tuning it to set up our roadmap, and it will begin operating in 2025. We want to transform the health and the well-being of Latin American populations through genomic research, and we want to focus in Latin America, but we do want to open to other areas of the world in an equitable way. And we also want to create a platform to generate knowledge that benefits local populations, has a global impact on research, encouraging development of personalized medicine, particularly respecting our roots and culture. This is our organizational structure. We have a founding steering committee. We are developing the structure right now. Right now, we have a temporary steering committee that has two co-directors, Dr. Harcir Velasco and myself, and then we will set up a scientific, technical director, ethics and regulations director, media relations director, and operations and sustainability, and more importantly, an advisory committee and a strategic partnership committee. One of our goals is to improve our partnership, improve our collaboration networks, intra and extra regional, to improve social impact, so equitable access, and particularly we don't want to forget educating not just our community and our professionals, but also educate the population. And obviously, we want to disseminate, publish our activities both to society as well as to the scientific community. And finally, we would like to have a practical application of our knowledge and do so in an accelerated fashion and in a strategic manner so that we are sustainable. That is a very important point. It's been mentioned by others before that the financial impact of these activities is significant, and we are seeking how this initiative, which has been around for 5 or 10 years, becomes sustainable and provide the results and outcomes we wish to have. Right now, we have 17 members in this steering committee. There are 8 countries: Colombia, Mexico, Chile, Argentina, Peru, Paraguay, Brazil, and Costa Rica. But we want to have many more. These empty spaces here are to be able to add new partners and members in Latin America. In January, we'll publish the criteria for joining our partnership, and we would like very much to see the participation of all of you. As I said, this is an initiative that does not intend to be the first or only one. We know that there are many other local regional initiatives, but what we want to do is establish collaboration bridges and be more efficient when using our resources by sharing the information in an equitable and fair way, respecting the cultural and genetic diversity of our populations. So this is our network. We urge you to follow our activities. And again, thank you very much to the Pan American Health Organization and organizers of this webinar for the opportunity to present this project. And we're ready to answer any question. Thank you very much.
Gracias, José Elias. And I don't know how many questions can I take, Ludwig? Can you please inform me for how long we can
Creo que podemos hacer pasarnos alrededor de unos 10 a 12 minutos.
10 to 12 minutes maybe in total to focus on responding the questions.
Yes, no problem.
Perhaps just respond to some of the questions we have.
I saw here in the Q&A. because there are a few questions that are very specific. Some are even personal. So I won't read those. So we'll take questions that are more general. And I will start with a question saying that it is difficult to get the governments from different countries to agree in implement policies for rare disease, especially because when you do that, you can generate additional costs, not only with diagnosis, but also with treatment for these disorders. So I will pose this question to Nathan, and because the person is asking, which strategies do you suggest that they can use to convince governments that it is important to have a program in the public health system for rare disease? Nathan? I don't know if we still have Nathan.
But there he is.
Is he there?
Hola, Iskia.
Oh,
I'm
okay.
here.
Okay. So did you
The
get the
host
question?
has stopped my video.
Did you get the
So,
question? Yes. How
yeah,
can we
yeah.
convince governments to do what you were doing in the Ministry of Health?
Just in a line, we must sit and talk about that together, like that reunion. This space today is a proof to this kind of initiative. We can start to talk about genomics. We need to start about the public policies in our countries. So this is the way. This is the way. Specific strategy I can draw. I can draw as Brazil uniquely, lonely. We need to talk with the other countries of Latin America to direct to address some answers, some solutions to this kind of question.
Thank you. I will read another question and then I will turn to Sherry because she may have some questions as well for the speakers. So one thing that José Elias commented was about people having what he called helicopter science, people coming from different countries, the northern hemisphere, and coming to Latin America and just doing the research and sometimes not returning the results and not even make it available, the data that they collect to the people that help them collecting in the specific countries. There is also another important issue here that someone mentioned, which is that people are sending, I understand, as samples for genetic diagnosis outside their countries. So, which might be a problem. So I will ask José Elias to comment on both. I mean, the problems that you can have with this type of science that's done by other people from countries that usually are not interested in collaboration, but in getting samples, and also to comment about problems that may arise from sending clinical samples to other countries for genetic testing. José Elias, can you comment on that?
Yes, thank you, Iskia. This is a big problem. Helicopter research is a main practice everywhere. The idea to reduce it is to formally request not to do that. And we can, if one person do it personally, is probably they don't listen to you. But we reject this kind of practice by group, by a Latin American group, by associations. We are stronger, and we must be listened. As you said, helicopter research means that you can send samples from multicentric or collaborative research, and they just include you into the publication. They didn't ask you to read the paper, the paper, or write something or express even your own ideas. And the other point is, if they send you the results, probably they are not enough, they are inaccurate, or they are incomplete. And this information is not enough for the population that you ask their collaboration for the samples. So they are ignoring the culture and genetic heritage of these populations. And the people feel ignored. So that's the main idea. You must involve that population, the local researchers, and the national researchers to make these kind of practices the less or the not the good ones. But for me, the answer is asking for groups, making strong voices by group, and telling to the world that we don't want that. We don't want to do that. We have very good research groups, high quality, and we can do that without any without any problem with the rest of the world. I guess our main problem is the lack of financial of money. That's all. It's the only thing that we don't have like the rest of the developed countries. And the second question about sending samples for molecular diagnosis in foreign countries, probably the same. In some cases, it's cheaper sending a sample outside your country than doing in your own country. And once again, I guess in every country we have at least one or two good labs who can make the research. I mean the clinical diagnosis. Probably a little bit more expensive because for that lab it's more expensive to get the consumes the regions, and also you have less opportunities, you have less volume of samples. I guess in that case we must help our own labs to make them strong, I guess that's my answer.
Thank you very much. So now I'll turn to you if you want to ask questions to the speakers.
Oh, for
Yeah, because I don't see, I mean, I have two more, but I will give you the opportunity to ask because the other questions are too specific. So we may have two more from the list here. So I will give you the opportunity for you to ask some questions if you like.
Yeah, you know what? Here's one here. I can do this one at the end.
Okay.
All right.
So
Okay. Yeah. So it's a question about strategies or suggestions we have for integrating all of these initiatives and integrating them between the number of countries that are in the Pan American organization, region. And, and this is something that the TAG committees talked about, that we talked about at the PAHO meeting in Brazil, that key to this, and again, getting to the last question, getting that data available for people in the Pan American organization to allow us to interpret what we're seeing in a clinical setting, because all of us, each and every single week, have trouble interpreting what we're looking at because we lack, there's the current databases don't represent our populations well, either our indigenous populations or the rest of the population in general. So I will throw this out to whoever would like to answer it. Is what suggestions would you have for bringing everybody in together and then really integrating across the Americas? So I don't know, Nathan, if you wanted to start, or whether Jose, you wanted to start.
If Jose,
Oh, okay, Jose. Okay.
you must, Jose.
I will speak in Spanish.
Okay.
Thank you for the question, Sherry. Yo creo que uno de los retos que
I think
tenemos
that
como
one of the
región
challenges we face as a region is to work as a team.
vencemos
If we're
paradigma
able to
de que no podemos
overcome
trabajar
this
en equipo
concept
como
that
población
we don't
latinoamericana,
know how to work as a team as Latin American
no
population,
podemos
if we can
competir
overcome it, we'll be on
con
the other
otros
side. We
países
cannot
por la
compete with
falta de
other countries
recursos,
due to the
por
lack
la
of
falta de recursos que
resources,
nuestros propios
a lack of
gobiernos
resources that
imponen
our very
a
own governments
investigación
impose
y
upon us when it comes to
a otros
research
temas
and
relacionados
other
con salud.
topics that
La
have to
única
do with
forma es
health.
trabajando
So the
juntos.
only way is if we
Iniciativas
work together.
como la ECLAM, que
Initiatives
tiene más de
such as
50
that of
años, ha
ECLAMC, that's
demostrado
over 50
tener la
years old,
suficiencia
has
académica
shown that it
como
has
cualquier otro región del
academic
mundo.
sufficiency at
Iniciativas
the
como las que
level of
realiza
other
para
countries.
investigaciones raras
Initiatives
en
that are
Brasil,
carried
en
out, such
Colombia,
as for rare
en México,
diseases in Brazil,
en
Colombia, Mexico,
Argentina,
and
son importantes.
Argentina, are
Pero hay una cosa que
important.
sucede con
But
mucha frecuencia.
there is something that we
Estamos
see frequently.
a la deriva cuando cambiamos de tipos de
When
gobierno
we
de
when there's a
políticas de
change
salud
in government or when this
de nuestros
brings
gobiernos que no
about
son
health
a
policy with
largo
a new
plazo. Y
administration,
eso es algo que
then we
tenemos
have
que
something that are not
reconocer.
long-term
Entonces,
plans, and we need to
trabajando en
combat
grupo,
this. So
trabajando
if we
en
work as a
iniciativas
group, if we work
regionales
on regional
consensuadas,
initiatives
todos tenemos
that
más
with
o
a
menos los mismos
consensus,
problemas.
we
Para mí
all
una
face
situación
similar
muy
problems.
importante
For me, a very
no es lo
important
que los 5 países
situation
más
is
avanzados de la
perhaps
región tienen.
not
El
the
problema
same as in the
es
five
las
advanced
regiones menos desarrolladas
countries of
de
the region,
Latinoamérica y del
the
Caribe.
least
¿Cómo
developed
vamos a ayudarles
regions
a
of
ellos
Latin
para
America and the Caribbean.
alcanzar
How can we
esa
help
ola
them
de las ciencias genómicas?
to
Entonces
reach
necesitamos
this
trabajar en
level
equipo.
of genomic
En
science?
segundo
And for
lugar, en
that, we
segundo
need to
bloque,
work
establecer
as a
frentes
team.
como el grupo que
And
ustedes
second of
ven que
all, we
habla con los
needed to
gobiernos,
establish a
por
front,
ejemplo, a
a
través de
group,
la
for instance,
PAHO,
that
a
speaks to
través de la
governments,
Alianza
where
Centroamericana
be
de Salud,
through ECLAC
estableciendo
or
políticas
PAHO, having
regionales
regional
para el acceso a
policies
las ciencias genómicas.
for
No hay
access
otra
to
forma.
genomic sciences.
Si
That's the
nos
only way to
quedamos
do it.
esperando a que nos den
If we
dinero,
are
nunca
sit
lo vamos
back
a
and
lograr.
wait for them to give us
Simplemente la
money, we'll
iniciativa
never
que tenemos
manage
en este
it.
momento no tiene
Right
dinero,
now,
pero
we
tenemos
don't
mucha
have
imaginación y
money,
tenemos muchas ganas
but
de
we have a
trabajar.
lot of
Busquemos la manera
imagination,
de
and we're
conseguir los
really keen to
recursos,
work.
pero
Let
no
us find
esperemos a
ways
que
to
nos los
obtain
den para que lo
resources.
hagamos.
We
Entonces,
can't just wait for them
trabajo
to
en
give us
equipo,
the
y
resources. They
segundo,
won't do
economía,
that. So
trabajo en
let us
equipo, y la
first
tercera,
work as a
trabajo en equipo.
team. So, and second
Y
solution, work as a
demostrar que
team. And
podemos
third
hacerlo.
solution, work as a
Pero
team.
en ese
And
sería
show that
una
as a region,
de las
we can
muchas
do it.
soluciones que podría
That
haber
is one of the many solutions that we can find to respond to that question.
Can I have 30 seconds more? Because I want to ask the last question to Nathan, because I think it's important. I think, Nathan, you show that Brazil has done a lot in terms of implementing genomics into clinical care. And two questions come from this observation. The first is that if you think that one important issue in making this a successful program for the clinical care within the public health system was the close collaboration between research and the health services. That's the first question. And the second question, in 20 seconds, because we're going to answer the first in 10 seconds, the second question in 20 seconds. If all this work that Brazil has done with the diagnosis of the situation, with health economic studies, all of this could be available to other countries if they want to do it, and they don't want to start from the beginning, start from scratch, reinventing the wheel. Because I think Brazil being a low and middle income country, things that are done here can serve as example to other low and middle income countries in America. So you have 30 seconds.
Cross collaboration is is the way. Okay. So we have some problems. Voy me permitir hablar un poquito en español para que
I'm going to switch to Spanish
personas me comprendan también.
to ensure people can understand me.
Algunas cuestiones,
There are some issues such as cultural limitations,
de protección de datos,
data protection
tenemos
laws.
algunos problemas
So we
para
do
compartir
face problems
informaciones,
when we want to
equipos,
share information
de
amongst
data
teams, in particular data
y
team.
una colaboración entre países. Brasil
And in order
tiene
to have
algunas
collaboration
leyes
with
muy
other countries,
protectivas
Brazil
de
has some
dados de
highly
brasileños.
protective
Esto puede
laws
ser
for Brazilian data, and this poses a
una
problem.
cuestión. Mas, pero la experiencia en Brasil
But the experience in Brazil
en creación de hubs
in the
puede
creation of
ser
hubs
compartida con los
is
otros
something that,
países de
yes, can be
Latinoamérica.
shared with other Latin American
Esto
countries.
ya tenemos hablado de esto
We have
aquí en la
already
reunión. Los
spoken
pacientes
about
con
this at the
enfermedades
meeting.
raras precisam
Patients with rare
ser atendidos
diseases
em
need to be
muchos
cared
níveis.
for
La
at many
atención
different
primaria,
levels, primary
necesitamos
health
de programas
care,
newborn
where we
screening,
need need
programas
screening
de vigilancia
programs
em
and
anomalias
surveillance
congênitas.
programs when we
Brasil
have
tiene
congenital
uma experiência
anomalies.
muito
Brazil
robusta,
does
muito
have
precisa
robust
em este
experience
campo
and very
e poderia
precise in these
compartir com
fields,
estes
and that is
países.
something that can be shared with
Mas
other
el
countries.
camino es nosotros juntos
Together,
hablarmos a respecto de esas situaciones,
we
de
can
esas
talk
cuestiones.
about
Mas
these situations
nosotros
and these
tenemos que hablar
issues,
también de
but we
data link
also
to
need
Latinoamérica,
to talk about
como
a
una
data link for
solución
Latin
posible
America. This is a
para producción
possible
de genomas de
solution to
referencia
generate
y
reference
poderemos también hablar
genomes,
de hubs
genomes, and we can
para
also speak about the
NGS,
hubs
compartir estos
for
hubs
NGS
entre los
and
países de
share the
América Latina.
hubs
Mas no
amongst the
es muy
Latin
fácil
American
hablar de
countries.
esto en
However,
30 segundos.
it's not easy to talk about all of this in just 30 seconds, as you can well
Now,
understand.
back to you, Ludwig.
Bueno, muchísimas gracias. La verdad, pues
Well, thank you very
muy
much.
satisfactorio
It
que
is
hemos iniciado
very
esta serie de webinars. Yo
satisfactory
quiero
that we
agradecerles
have started with this series of
a uno de
webinars, and I'd like to
los
thank each and every one of today's speakers for their time. We know that
de fin de año, que
we're
cada quien está pensando en
approaching the end of the year and the holidays, and everybody's thinking about that. Well, perhaps not everybody, but many of us. So I'd like to thank you all for your participation, and thank also those who have supported us in arranging this webinar, Magalis, Initia, and all the others that have supported the logistics, as well as the interpreters who are providing their support. So that's on the one hand. And then I'd like to thank all the participants that were connected today. We hope to continue with these webinars in January. It is important for all participants to write to us, let us know what topics they're interested in. Genomics is an inexhaustible topic. There are many different groups, different projects. So we truly need to hear from you about your interest, and maybe the next webinar will focus on oncology. But we need to look further into this, and your inputs will be appreciated. The second thing I wanted to mention is that we do want to generate a solid community of researchers and experts in genomics. Obviously, the authorities and the regulatory authorities, ethics committees, the entire ecosystem can be incorporated at a later date. And that's why we are trying to generate a platform so as to have a community of practitioners. And here again, we require your guidance. We need to understand your needs and where we can play a more solid role to implement it.
And finally, before closing, Pablo, I don't know if you have something to say about the work we've been doing at PAHO and headed by you on screening. Go ahead if you wish to do so. Other than that, I'd like to thank everyone and wish everybody a Happy New Year. But let me call on Pablo to talk about that, and then he can conclude the meeting. Pablo, thank you very much, Ludovic. I join you in thanking and congratulating everyone and the wealth of information we heard today. And I would just mention that as the PAHO, and in response to some of the questions, our role is to be the secretariat for the countries so that the countries can move forward with this process in coordination with Ludovic and the unit under him. We have developed a clinical practices guide based on evidence for the screening for different neonatal diseases, both structural and functional. And this will be made available to the Committee of Experts at the beginning of next year. And this will be an aspect that we hope will help countries have the technical standards, but also help them in pushing forward legislation, developing policies, and setting up research networks and have trained experts to start the whole process. We firmly believe that cooperation between countries and the strengthening of countries in developing policies, in finding the resources and establishing guidelines will allow us to enhance and support what we are doing, and it will help us develop genomics tools to improve the health of the population, which is the purpose of this seminar. And we hope that this will be replicated in other areas as well. Again, thank you very much, and our best wishes for the festivities coming up, the holidays, and for next year. Thank you very much. Thank you, Pablo. My last word is to thank the members of the global group of experts that have been supporting us with this and all the other initiatives, Sherry and Abela, for the support they've given us and continue to provide. And thank you to all the experts as well. Thank you very much, and until we meet again.